The medical complications associated with mild brain injury are fairly common.
The main complications of concern are increasing bleeds within the brain, whether it's an epidural hematoma that usually presents within minutes to hours, or an expanding subdural hematoma, which can be days or weeks.
Increased intracranial pressure, spinal fluid leaks, things like this. Hopefully these diagnoses are made in the acute period where medical attention and neurosurgical evaluation is available. Other diagnoses such as seizures and post-traumatic hydrocephalus are less common, but nonetheless medical complications are an important and far-reaching component of mild traumatic brain injury. Most seizures occur within the first 7 days after traumatic brain injury. If a seizure occurs, these are usually treated for a short period of time. Delayed post-traumatic seizures, or those that occur after 7 days, usually should be seen by a neurologist so that appropriate therapy can be instituted with anti-epileptic medications. Thankfully, the effects of post-traumatic seizures are usually not severe and can be well controlled with medication. Post-traumatic hydrocephalus is another diagnosis which we see with increasing frequency. This has to do with an impairment of the absorption of cerebrospinal fluid. A patient who's had a mild traumatic brain injury may present in a declining fashion several months or even years after traumatic brain injury with hydrocephalus. Imaging here is critical because a CAT scan of the head, for instance, can make the diagnosis of hydrocephalus. When an original comparison study is available, we realize that these patients are very susceptible to having an impairment of cerebrospinal fluid metabolism to the point where they will benefit from the implantation of the shunt. Other medical complications from traumatic brain injury can include the inability to smell, anosmia, for instance, headaches, dystonia, tremor, sleep disturbances, vertigo. Almost anything that can manifest from a neurological disease can be seen as an after effect of traumatic brain injury. Practitioners need to understand that these effects may be directly related or in a delayed fashion related to the diagnosis of traumatic brain injury.
It's important to know when an imaging study may be helpful in the management of your patient, because many times imaging may show an abnormality, but that will not change treatment. I think you should seriously consider imaging when the person has either not improved or there's been a deterioration in their cognition or their emotions or their behavior, and you really want to rule out that there's been another brain lesion that may be accounting for this. When you order imaging, the imaging that should be ordered is an MRI, not a CT scan. Because except for the acute setting, CT scan is not going to be sensitive enough to detect the abnormalities you're looking for.
Any significant change in symptoms in the post-acute stage of recovery indicating neurological deterioration should lead to referral for immediate neuroimaging and be followed up with detailed neuropsychological evaluation.